Good afternoon, this is Carol. Thanks for attending this section, which I'm going to present to you as an academia, how we train future DRR practitioners. Okay, so first of all, let me introduce our center. My center working in is called Collaborating Center for Oxford University and the Chinese University of Hong Kong for Disaster and Medical Humanitarian Response, CCOUC. We established in 2011, and we are situated in the School of Public Health of the Chinese University of Hong Kong. So as a mission, we want to serve as a platform for research, education, and a community knowledge transfer in the areas of disaster and humanitarian response, in the crisis policy development, planning, and development. So, as what I said, because we have the vision and mission, therefore we have to develop a strategy. So our training of future DRR practitioners, how we train them, we base on research, education, and knowledge transfer, as I said. First of all, to meet the objectives of training disaster risk literacy and community disaster resilience people, we conduct a lot of research. And then, not only research, we also have a platform for education. We want to teach the future DRR practitioners how to identify risks, how to identify areas for improvement, and to evaluate the effectiveness of the programs. Last but not least, because we have to transfer the knowledge from what they learn to the communities. Therefore, we conduct a series of health intervention, disaster risk reduction programs in the community. So as what I said, we want to translate the research theories into research and as well as evidence-based intervention programs for our future DRR practitioners. Therefore, we have developed the field training program, which is unique since 2009. And I would like to quote our ethnic minority health program in China as an example to illustrate what we talked about earlier. First of all, as you can see, we have ethnic minority health program in China. We select sites which has to meet the following 4 criteria, which include remoteness, disaster prone, ethnic community base, as well as the extreme poverty. It's essential to meet the following 4 criteria to identify a site, because we have to conduct research, and this is for the generalization of our research findings, so we could do it in other communities in China or even in Asia in the future. So as you can see, sorry, this is a bit small, but as you can see, we have already identified 14 villages as of now in different parts of China, which are prone to different hazards, as you can see in the key, under the key. So they are prone to different natural hazards, and the ethnicity is already written there. So we also, as an academia, a multidisciplinary team is necessary. So on one hand, we have undergraduates and postgrad trainees from all across the region, like from different universities in Hong Kong, Asia, as well as global. And we have a group of academics and professionals from different disciplines, like public health, emergency medicine, epidemiology, even social science and arts. So together, we form a multidisciplinary team to go through the whole cycle of 18 months at maximum in China of the ethnic minority health program. So these are the focal points that we work on. Although it's 6 focal points, but they're all interrelated, especially for the harmonious between the environment as well as disaster and climate change. So as I said, this is So to be more specific, how do we do research? In order to get them into the field and know more about the limitations that as a trainees will encounter, we bring them to the field and demonstrate all the field limitations. For example, the time limitations and the everything that we would encounter during the we conduct the research. And we also introduce the new methodologies, research methodologies, as well as to get a taste of all the different dimensions of research or applications, like KAP, like focus group discussion, like quantitative analysis, everything. We want them to be prepared so that even though they join to be a researcher in the future, they know what they have to do and what are the limitations they must be encountering during the rural settings. Second, it's also very essential for us to have a comprehensive set of curriculum. Like we go through a set of briefings and trainings before every field visit. We also have masterclass and field lectures in the field. Not only this, we also have to ensure that debriefings will be held after each section, because so that we could consolidate all the experience from the students themselves. Last but not least, we have online courses which are totally free, and then we also have publications which I could share with you later on. This is the training manual that we have produced in 3 languages. Last but not least, as I said, we have to transfer the knowledge from the trainers themselves to the community. There we have identified few key and important messages related to my focal points mentioned before. We have to ensure that the trainees would deliver easy to understand, low cost, but high quality messages to the villagers in the field. More importantly, the outcomes must be measurable so we could evaluate the effectiveness and efficiency of our program. Last but not least, sustainability is always our concern. We have to make sure that they would carry on in the future. So as I said, I have another props demonstration. This is the disaster kit that we distribute to every villagers in the community. It includes all the things that are listed here, from water and sanitation to food and nutrition, hygiene, so you can take a look afterwards. Yes. Okay, so far, as I have said, we are not doing our project only in China. We have expanded to Nepal, and we have right now got 15 villages in total. And the people being trained is around 689 as of now, since we conduct the program in 2009. And we have reached villages like 17,000 in total. Okay, so before I close, I finished my presentation, because despite the fact that we are running quite smooth, we still have encountered challenges, like how to consolidate the training toolkit and how to deploy an effective DRR campaign. And of course, we have to provide more platform for our future sharing lessons. Okay, so before I really end this discussion, I would like to share with you a video. Yes.
呢個 trip 其實係我哋嚟四川嘅紅岩村，我哋想睇下我哋之前嚟過呢度做嘅一啲健康嘅推廣嘅成效係點樣樣。第二個目的其實都係想加深一啲本地村民對於一啲災難嚟嘅時候嘅應對。
我们凉山是一个彝族自治州，直接从那个奴隶社会就过渡到了社会主义社会，没有经过中间几千年封建社会的发展。红岩村在山脚下，有暴雨的时候就会很容易发生 洪灾啊之类的。
每次都下雨的时候，乡亲们都不敢走到江下。那天我很害怕，一看到那个水河那儿，什么全部都被水给冲走了。
We choose communities which is going through epidemiological, demographic and social transitions in the 21st century. We follow the community for about 12, 18, 36 months as a cohort to understand or to track the patterns of changes.
正反面都有，还记得我说统计表怎么用的吗？就是去到每一家每户，即使他没有接受你的访问，或者家里没有人，只要你去了那一家的，你都要有所记录。这样我们到时候就会算出来，我们去的那家庭当中有多少是可以做到访问的，就是大概有个概念，知道那个 response rate 有多少。
做呢一個項目咧嚟農村咧，最重要嘅一個議題就係做研究，因為咧其實我哋知道資源始終係唔係好多嘅。如果你要去一啲偏遠嘅地方做一啲公共衛生啊、防災嘅工作咧，其實你一定要揀一啲有效用嘅干預嘅，我哋叫 evidence-based 嘅 intervention 先至會最有用。
行過一條河之後咧，其實仲有一段山路嘅，跟住就會上翻車，車帶我哋上山，因為我哋慳翻啲體力應該做家訪。
分开是想从下往上，还是走到最上面再往下面走？1点半、2点，最晚2点半到这里吧。 这一次我们是基本上每天都有6个小队，2个人一组去做入户调查。这是香港的大学生过来的，想跟你们做一个访问，就是了解一下你们这边生活、健康、卫生的情况。做了60多户，基本上去了大部分我们可以去到的家庭。你觉得你现在的健康状况怎么样？
你是这样的个，这次都不怕，这次呢拍摄都不怕高，别天不拍。
啊，
那得确实是，他不你第一种嘛。
这个是个那个还有很多功能，还有不同的功能。这个是个那个万用刀，它这边你让你孙女帮你看，然后会告诉你的。它这边有数字，就是每一个。我去的3个家庭呢，很有意思的是，他们居然都还保留了我们去年发的一些纪念品，就包括宣传那个口服补液盐和救援包的那个宣传单张。 然后还有包括那个救援包，也有一些问题，就是救援包里面的内容呢，可能就已经不是很齐全了，有些东西就被小孩子拿去玩了。
这你们早的说。
我们又会有这个活动，好像去年一样。
哎，阿爸今年就那半截子的，那不够了，这够肯定今年的这4个了。
哦，阿不
能拉，哎呀。
阿不让我看。
哎呀，我肯定会来的。
好的，太好了。
他说到时候来跟你们吹牛玩。
The value of doing field-based research is that it would have very important impact on several levels. From a scientific point of view, it would give the important evidence for scientists, policymakers, and frontline workers to use their limited resources in an evidence-based way, because we know there are a lot of needs in the society, but why do you do so?
Thanks for coming, but indeed most of my colleagues are all here. You're more than welcome to share with us your experience in conducting training for future DRR practitioners. Thank you so much.